of that. And I'll start as people kind of come in here. I think I'll start so we have enough time for that. So we can talk about COVID first. I think, first we're going to talk about where are you joining us from. So welcome everyone again. Just want to kind of have a little poll question here. So Maryland, DC, Virginia, Pennsylvania. We have some Pennsylvania people as well. Another state or another country, that'll be interesting. Zoom is international. So mostly Maryland, some from Virginia, welcome everyone, and a couple from DC, so welcome everyone. So fairly local today. And then what is your, okay, so what have your stress levels been like during COVID-19? How would you rate your stress levels? So I believe this question is 0 is zero stress at all, no stress. And then 10 would be sort of off the charts type of stress, which, as we know, stress plays a big role in modulating the immune system and helping us determine how well we are, you know, how's our wellness. It can prevent us from getting illness. And there's different ways to modulate stress, which we can talk more about also today, including with myofascial release. So most people are at a 3 to 6. So some moderate amount of stress. A couple people are at a 10 plus. Hope that things turn around more for you soon, and we can, you know, try to figure out some ways to help modulate that. This is a slide from a couple of times ago. We just wanted to repeat that we do have LabCorp testing here that tests for blood antibodies for coronavirus. And we also have nasal swab available if people have positive antibody testing. We are testing people that are not symptomatic. If you have a cough, shortness of breath, things like that, we'll see via telehealth. If you really have severe symptoms, we'll have you go to the ER for that. There is a saliva test as well. That's called Vault Health that you can get, and they can ship it to your house if you're interested in that to check to see if you're infected or not. And then the other COVID update is this website that is a nice resource for figuring out how what the prevalence of is of COVID in Maryland, and I think there's some for every state, so you can go to your own state if you're not in Maryland. But there has been a downward trend over the last over 2 weeks now in hospitalizations and deaths, and case increase in terms of percentages now down. I think on yesterday it was only 1%, which is the lowest it's been since April, I believe. So things are making, there are some improvement here. The total number of cases continue to go up, obviously, but the trajectory seems to be lower, which is good. So I know Governor Hogan is thinking about reopening things next week more, or rather Montgomery County is thinking more about reopening things, but we'll keep on kind of doing what we can do here to help keep everyone safe. The community question, this is from Laura. Let me see if Laura's on here. Laura, yes. Hi, Laura. Thank you for this question. So question was, is chlorine dioxide effective for the treatment of COVID? So a trial from Ecuador preliminarily showed that there was cure from COVID-19 within 4 days of treatment with intravenous chlorine dioxide, which is a disinfectant that is used in purifying drinking water. So it's safe to drink because we probably all drink it if you're drinking water, if you're not filtering that. But it's 1 atom of chlorine and 2 atoms of oxygen make chlorine dioxide. And the theory is that as oxygen levels go up with this treatment, it could help relieve blood clots and have antimicrobial effects, which I'll talk about in the next slide, as the true reasons why COVID is dangerous for people. So an NIH clinical trial is actually underway right now to evaluate oral chlorine dioxide for COVID treatment, and that's an oral solution versus the IV. So that'll be interesting to follow. However, for COVID-19 per the FDA, there's still no proven prevention or treatment. The FDA has in the last week, I believe, started to start and fund something called the CTAP, the CTAP, which is the Coronavirus Treatment Acceleration Program. So they're funding, research to try to, hundreds of different trials are in place right now to try to figure out the best treatments, the best drugs, vaccines, et cetera, to try to help to defeat this or to at least get it under control. From a functional medicine point of view, it's so far turning out that COVID is actually not only a viral infection, however, but it's also a disorder of acute inflammation and blood coagulation, meaning blood clotting. So what I kind of term it as instead of COVID-19 is actually something called AIRS, which is just my term. It's not an official term, but acute inflammatory response syndrome. So it's the inflammation that's making people go to the hospital, that's killing people. And so we know that this virus not only affects the lungs, but it affects the kidneys, the liver, the heart, brain, and blood, and other organs as well. It also resides in the gut. It resides in the genital tract, potentially for some people. So again, this is a systemic issue. It's not just a lung issue. So from a functional point of view, we want to reduce inflammation. We want to balance the nervous system. We want to increase natural killer cell, T cell, B cell activity, increase secretory IgA, improve circulation, and optimize different micronutrients, including vitamin D, zinc, and A. And then we want to reduce inflammation overall. So balance blood sugar. Think twice before going to get that extra piece of candy there. Balance out the gut microbiome, improve your digestion, balance your hormones, manage physical and psychological stress. A lot of times with stress, what happens is the muscles tighten up, the neck tightens up, the head, the lower body tightens, and the fascia gets restricted, and then you have less blood flow and less immune cells going to the organs that are needed to be protected right now. So again, that's something we can do today on Myofascial release with Kari. Also, we want to lower something called fibrinogen, which is an enzyme that would, in theory, if it's higher, would increase the risk of blood clotting. So these are things that we could, do overall. So overall, we want to actually ensure both immune system strength, so having a strong immune system, but also the immune system's not over-inflaming your not attacking your own body, essentially, not causing what I call AIRS, which is acute inflammatory response syndrome. So that's the key to maintaining and optimizing the immune system and staying healthy and well. We are going to have a group class that I think some of you have already signed up for, but it's going to be built to insurance. It's only available this go around to CIH patients. There's 2 sessions available. We're going to be talking about how to make your immune system stronger, how to balance your immune system so that your body's not attacking yourself, basically. And there's 2 sessions there. The first session is full, which is next Tuesday from 12 to 1:30. And then the second session, there's still some slots available. So that's June 2nd, which is Tuesday from 4 to 5:30 p.m. So that's going to be a group class on Zoom, and love to see you there. And we're going to have really good information on functional immunology and how to optimize your immune health. Some of these things researching this year that are fairly new here, that are not even kind of part of the general knowledge base, for a lot of people. So we can kind of go through that, and that'll be a good class, educational and a community class, and a lot of fun too. So please message Gina Washington and Charm to register. She's the person, Gina's our coordinator for that class, and she'll be signing you up if you're interested in that. So hope to see you all there. And we can go to additional updates here. And I think Katie and Jen, our nutrition team, are continuing to see people on telehealth. Laura and now Meg, our second IV nurse, are doing IV nutrient therapy. So expansion of hours with Meg is coming soon in June. So we'll have 5 days a week open by June 1st. Liz has restarted her acupuncture practice for the great benefit of her patients. And Corey is starting June 1st. Corey's back doing acupuncture June 1st. Just confirmed that with him today. Myofascial release, Kari is contributing to your health, and it's postponed for now because of COVID, which is totally understandable with all the different restrictions right now. And I think she's really been really gracious in offering these sessions to all of us here. We've got great benefit out of the one 2 weeks ago, and again today. We're looking forward to that. So thank you, Kari. And then naturopathic medicine, if you're a patient of Dr. Keats or Dr. Davis, they're continuing on telehealth for now, and as is Dr. Gilman for holistic mental health care. So we are accepting new patients overall. You can call Gina Washington. Again, that's her direct number there for new patients, 301-602-2372, or go to the website to learn more about us if you're want to know more about that. So, and then next week, just to kind of talk about that for a bit, is Colleen Zontak, who's a clinical herbalist at Smile Herb Shop. She is going to give us some great information. That's another free session, and it's going to be next Thursday at the same time here. And there's going to be a link in the chat that Jen will provide on that. So thanks, Colleen. So real quick about that, what questions do you have about herbal medicine? It's the next polling question here. So looks like multiple choice. You can choose any and all answers. You can chat in there. Thank you all for who joined after I started. Thank you all for coming. I know this is a valuable time for you and lunchtime, and you probably have a lot of Zoom meetings, so we really appreciate you being here. And let's go with, so which herbs to take for stress, which herbs to take for immune health, best way to take herbs, how to know what herbs are best for you, or other, if there's other ideas you have, I'd love to hear from you. And let me see if we can, yeah, the chat there. Okay. And Jen put the link to register for the herbal webinar for next week in the chat box. So if you are interested in that, please sign up there. Sugar yeast overgrowth, yes, that's a great one for herbal. So which herbs to take for immune health makes sense right now. How to know which herbs are best for you, definitely need someone that's knowledgeable of the herbs and their effectiveness, safety, dosing, you know, type, frequency, and then, you know, best, you know, whether it's a tincture, whether it's a vegetable glycerin or alcohol, or, you know, and then probably interactions with any medicines you're on or other herbs. So I think that's helpful. Best way to take herbs, which takes herbs to take for stress. So pretty much all of them, which is great. And I know that Colleen's going to cover all of those. Let me just make sure there's nothing else in the chat there. I think there was all herb, yeah, Margaret said all herb questions sound interesting. Yeah, so I think Colleen will, thank you, Margaret, and thank you, Laura, for chatting on that. We will cover all those, I believe. We'll get that information over to Colleen so she can personalize that presentation for you. Thank you. And then we're up to session 2, very exciting. I'm very excited about this, my official release session with Kari. So I'm going to turn it over to Kari here. I will stop share and then stop video, I think. And then Kari can, you're up.
Hi, everyone. Thanks for joining me today. Thank you, Dr. Wong, for having me. This is our second session, but I thought we'd review a little bit with fascia for any newcomers. Fascia is a 3-dimensional connective tissue. It's like if you picture a spider web in our body, but from the top of our head to the bottom of our feet. Connective tissue that is there for our support and flexibility. It holds a lot of our hydration. When fascia is thickened from stress or inflammation or surgery, repetitive postures such as forward head, lots of use of the computer, injury, and restrictions can form. So when restrictions form in the fascia, it can produce pain or misalignment and limited range of motion. Myofascial release was developed by John Barnes. He's a physical therapist from Pennsylvania. He has 2 treatment centers, one in Melbourne, Pennsylvania, and another in Sedona, Arizona. He's been doing this work for between 40 and 50 years, teaching all around the country, thousands of therapists. So this method is characterized by long, sustained stretches and compressions. So we're going to be doing self-care stretches. Compression would be using a small ball or a foam roller. The stretches should be held for a minimum of 90 seconds. That's when the body starts to release. After 2 minutes, 90 seconds to 2 minutes, the body starts to produce an anti-inflammatory protein called interleukin 8. The studies have shown that after a period of 5 minutes, the body produces even more of that interleukin 8 protein, which is very valuable, especially in this time of stress, or if we're having tension or pain or inflammation. While we're in the stretches, we never want to force the body to release. So I'll talk you through just staying at the barrier. So where the body asks you to stop when you start to feel that stretch, I want you to stop there and breathe into it. And as time goes on, as we reach the 90 seconds to 2 minutes and possibly 3 to 4 minutes, the body lengthens, the tissue lengthens and lets go and creates more room and creates more alignment. So I really want you to practice observing that barrier and breathing into it. And I'll talk you through all of that. A release can feel like tissue lengthening or butter melting or coconut oil melting. It can feel like pulsing or tingling or change of temperature. Sometimes we have imagery or memories come up. Emotions may release and occur, and any of that is okay. Try to just be in the witness position versus evaluating things. If you feel a pull or tension in another area of the body that other than what we're working with, that just signals that there's a connection to that tissue, and that would be another place to work and stretch next. Home care is a great way to increase your body awareness if you feel disconnected from your body. It's also a great way to work on anxiety, lessen anxiety, deepen your breath, let go of some deep emotions, and also, of course, to resolve some physical pain. If you have any joint replacements or fusions, if there's fractures that are healing right now, dislocations or any open wounds, or hypermobile joints, that is contraindicated at this time. With joint replacements and fusions, I would just be very cautious. Doesn't mean that you really can't do these exercises, just listen in deeply. If anything hurts, I want you to back off completely. So let's go through a softening exercise before we begin. So it's necessary to feel these softening exercises so you can release into the stretches. So what we're going to do first is maybe be seated or comfortably positioned. And close your eyes gently. And take a couple deep breaths in and out. Let's select the area of our body. Let's think about our shoulders and our arms, our forearms and our hands. So what we're going to do before we start, I'm going to have you tighten into that area for 5 seconds, and then I'm going to have you soften and release. So with our arms and our shoulders, go ahead now, and also with your eyes closed, tighten that area. Tight, tight, tight. And let go slowly. And feel that release. And take some deep breaths in and out. And notice how it doesn't take any effort for those muscles to relax. It's a natural feeling. So let's go into this again. Building slowly, tighten your arms, hands, and shoulders. Maybe you can even bring your shoulders up to your ears. Tighten, tighten, tighten. Hold, hold, hold. And then slowly release and let go. Let your shoulders come all the way down. They're up. Open your hands and arms. And notice how that feels different, and that's a natural letting go. And still with your eyes closed, let's take a couple more deep breaths. And on your next inhale, Notice the pressure building in your chest and ribs. The more air you take in, the more tension is building. Take a really deep breath in and let go. And feel that soften and release. And again, breathing in deeply, blood around your chest and rib cage. And soften and release. Notice how your body just naturally lets go of that tension on the exhale without any effort. So we're going to do this a couple more times, but this time on the inhale, I want you to hold before you exhale. Hold and notice the tension. And soften and let go. And melt. Melt, melt. And let's do it again on your next inhale. Hold. And soften and release. Keeping your eyes closed. See if you can engage the whole body into that softness. On your next inhale, breathe in and hold. And relax deeply. And just let's take some natural breaths. Bring all your awareness into your body again. I'm going to do a couple of stretch standing. Standing next to a countertop or a chair or a couch or a desk or a table. We're going to do a standing low back stretch to begin. So I have a chair here. I'm just going to pull it back. And if you have a countertop or desk, have it out in front of you so you can reach your arms up. I'm just going to do arm over arm. I'm going to walk my feet back until I feel a stretch in my low back. You can stay here, stacked over your arms, or you can bring your chest between your arms and sink your belly low to the ground and your tailbone pointing up towards the ceiling. It's not actually doing that. It's just more of a visual. So you want to tip your hips towards the ground. And you can relax your chest in between your arms, or again, if this is more comfortable, over your arms. If you're on a table or a desk, you can reach your arms out and telescoping them out opposite of your body. Hips are moving opposite of your body, and so are the arms. Resting your head and neck between your shoulders, or again, on your arms if needed. My knees are mostly straight. There's a little bit of softness in them. Find the place that's right for you. If you need some bend to maintain the posture, that's okay. Just stretch into that area. Breathe into those tight areas. It may be different on the left and the right. And then into your knees more if you need. Keep listening. And shake your head gently yes or no to keep the tension out of your neck. Maintaining your tailbone tipped up towards the ceiling and your belly low towards the floor. If you're in a cat-cow position, so repeat the cow motion. If you're on a table or desk, reach the arms out. Even in a chair, you could possibly feel stretch along your side body or scapula area. And close your eyes and just feel. And go back to your breath and bring your awareness there. Keep it comfortable to lengthen each inhale and exhale. As the body softens and the stretch dissolves, you can go into it deeper, reaching your arms away from you and your tailbone up, stretching into the low back and the glutes, and the back of the legs. Opening that spine. And keep feeling. And let yourself take the brakes off completely. Let your mind focus only on the breath and feeling into your body. And as tension builds or as the stretch increases, breathe into it. Very forcing a release, just allowing yourself to feel the stretch. Hold there. And let it soften and release. If you'd like to focus on one area, one side, the right or left, you can cross one foot over the other and stretch into one side. Here, just one leg is more weight bearing and one foot is on the other. Do what's appropriate for your body. And keeping no tension away from the neck. Use a movement just to soften. And holding on to that chair or desk. You bend your knees. And come up. Walk forward. How's everybody doing? Does anybody have any questions? Okay. You can bend and straighten if that feels necessary or needed. Okay, I'll try to speak up a little bit more. It's hard to hear me a little bit. We're gonna do most of the other ones upright, or all of the other ones upright. So is this better? Can everybody hear me okay? Okay, great, thank you. Wonderful. So that was for low back, hips, glutes, and hamstrings. So everybody's body is different in our tightness. The history of our bodies are different, how we've used them and what our postures are. So today you might feel it in your hamstrings and somebody else might feel it more in their glutes and low back. And tomorrow you might feel it a different area, especially if you're able to release deeper. I have a question here. It doesn't really matter if you, I have a question about your back was slightly arched, but mine was more rounded. I think what matters is that that you're feeling a stretch and softening into that. And again, everybody's body is different, so my restrictions are gonna feel different. And I want to encourage you to move into those areas of tightness. If you need to, turn a little bit or stretch a little bit further, I'm giving you a basic guideline and setup, and then I want you to, like I was saying, take the brakes off. Just really move into your own body's area of need. Okay, I have a question about if it hurts internally. I would stop and back off. I don't want it to hurt anywhere. I would like you to feel just a gentle stretch, just a gentle pull, and then as that softens and resolves, I want you to go into it deeper, but only very slow pace. The long sustained stretches is where we're going to get the most benefit and more permanent release of the fascia. Just be gentle. If you can't hold it for the long period of time, that's okay. Try to do a minute, try to do 90 seconds and build up to it. Always in the practice of increasing awareness in your body and definitely listening to your body. Where is its stopping point, and what is it saying? Okay, we're gonna go into some quad stretches and hip flexor stretches. So I'm gonna have you stand. I'm gonna use a chair, but you can stand by a couch or something to support you. So as you stand, I'll bring the chair back here. I'm gonna bring my lower leg onto the chair, like this. And if you can feel a stretch here, and this feels good, let's stop here. If you're more flexible in your hip flexors, you can use the chair as a support or a wall or the desk. I'm gonna have you place your ankle or ankle or foot in the same side hand. And you're just pulling here. Your knees are together and your hips are level. So if you're here, standing in support, knees are together, releasing into that hip flexor and quad. Keeping your chest open, shoulders relaxed. And you can support yourself if needed. If you're having the sciatic ache, I would be very gentle. I think that I would hold off on this to calm the sciatic down. I don't think we want to pull on that area of the sciatic nerve. Let's be gentle with that. So in that case, if you are feeling it in the sciatic nerve and going down, you can just stagger your feet and move the hips forward to produce a nice stretch here. And it's just a variation of the leg being on the chair, couch, or in your hand. Wherever you are, see if you can soften your body. Is there any other area that's speaking up? Letting go gently, never forcing your body to release. The front of the leg softens. You can move into it deeper. Just work within the boundaries of your own body. Breathing. You do a little inventory of your head and neck and shoulders. Is there anything that's holding there or tense that you can let go of? What can become soft now? Keep your mind curious, just your body. And reinforcing that posture of knees together, hips level. It's also something you could do laying on the floor. We can talk about that after you. Take a couple more deep breaths here. Opening in the chest and shoulders. Lifting your chin. Continue to support yourself if needed against a wall or a chair, countertop, or desk. And gently drop that lower leg. Let's kick it out in front of us a little bit. And bend behind us. Just gentle movements. Soften and relax. Maybe bend into both legs. We're going to do the other side. Does anybody have any questions about the variations? Okay, so let's work into the opposite side. And again, you can put that lower leg on a couch or a chair. If that doesn't feel right, if that's too much, you can extend the hip forward, stretching right here, the quad and the hip flexor. You can hold the ankle or foot to the same side that you're stretching on. Hold it with your hand. Wherever you are, sink into that. Chest is open, shoulders are relaxed and down. You can support yourself by using a wall or a countertop. Keeping the hips level and the knees together. Create more length and you can go deeper into the stretch. Think back to that softening exercise. Feeling that tension build as we inhaled in, and your body effortlessly releasing on the exhale. Softening deeper. That image of taffy pulling or butter melting. Gently getting softer and softer, giving you more length and freedom. Checking in with your neck, shoulders again. Seeing if anything is speaking up there. Dropping your shoulders. As you soften and release and go deeper into the stretch. Let's hold here for a couple more breaths. Wherever you are, bring your foot back down to the floor. Let's do again. Just a gentle kick forward. Doesn't have to be very high behind you. Just reintroducing that movement of the hip. Now let's go again. Bend and release. Bend and straighten. And back to both sides. Just move side to side. Bend into the knees. Bend one knee and then the opposite. Okay. We're going to go back to our chair. You can also do this on the floor if you'd like, whatever's most comfortable. I'm going to sit at the edge. I'm going to stretch again into the hip and the glutes. Everybody doing okay? Please let me know if you have any questions or anything. I'll try my best to answer them. Have you bring one leg and cross it over the other. I'm just sliding back so you can see my ankle is over my knee. If you can't get it that far, that's okay. Just bring it as far as you can. Make an adjustment. If you're on the floor, your legs would be straight out. Your straight leg would be straight out. So clasping your hands over the bent knee, or your arms if you have access to that. Sitting up straight, we're going to pull the knee into your chest and shoulder. Same side, knee and shoulder. If you can't get the foot across the knee, you can set it on top. Or even just holding in space. Find the spot that is right for you in your body. Feel that edge of stretch, and then work from there. Again, pulling that knee into your chest. You feel a stretch in your glutes or your IT band. It's the side of the leg or hip. Just continuing to breathe into that. And if it feels right, you can turn your torso towards that knee as you pull in. And straight on is okay too. And find that spot in your body. Find that restriction or tightness. And hold there. Breathe into those areas. Stacking your spine. Keeping your chest open and shoulders back. As I turn my torso, I'm turning into that knee and away from the midline of my body. Away from the center point and pulling the knee in. Just think of all the oxygen and nutrients that you're delivering as you take that deep inhale and exhale, circulating that blood, opening up these tight areas, helping them to rehydrate and expand, giving you greater range of motion, flexibility, unblocking that energy. Stacking the spine again, if you feel crushed. Let's hold it for a couple more breaths. Try to have all tension away from your arms that are holding your knee. Reminding your shoulders to come away from your ears. Okay, and if you're in a twist, slowly unwind back to center. Release that lower leg, that leg down to the floor. Sit up. I'm going to go into the other side by crossing your ankle over the opposite knee. You can place your foot on top, or you can just hold it in space if needed. Clasping the hands or the arms around your knee. You're going to pull it into that same side, shoulder or chest. Just pulling it in. You're stretching your hips and your glute. You might feel some hamstring or IT band, back of the leg, one side of the leg, side of the hip. Pulling it in and gently breathing. Discover where that area is, where there's an edge. From feeling no stretch to a stretch. Stop right at that area where you feel tug, pull. Right there and hold. And give your body a chance to reorganize that tissue. Soften the restrictions. If you have access to more mobility, you can turn towards that knee that is up. Turning away from the midline. Keeping your chest open and your shoulders down. Stacking the spine. Using this as an opportunity to connect with your body and keep your awareness within. Just being curious about what you feel, what your body's telling you. Use this opportunity to listen in deeper. As the stretch creates more space for you, then you can move into these areas deeper. Pulling that knee into your chest and shoulder. Just honoring the boundaries that your body has. Keeping the breath even. It's in your comfort zone. Using this opportunity to breathe a little bit deeper than you do during the rest of the day. These long, deep stretches, sustained holds are excellent for your nervous system. It likes these opportunities to heal. Your body likes this opportunity to breathe a little bit deeper. Pulling the knee into your chest or shoulder, and turning away from the midline if you need to go deeper. And let's hold this for a couple more breaths. Okay, you might feel this in a completely different area than what we're working on. And let's slowly unwind, bring the torso back to center if you were in that range of motion. And lower your knee and foot to the floor. And let's stack the spine. And let's just come back to standing for a moment. Use this opportunity. Stand and stretch. If arms above your head is not okay, just bend. Do some gentle movement side to side. All these stretches are excellent for your low back, even the quad stretches, the thigh and hip flexor stretches. Just a nice range of motion. Mid arms together. And twisting to the side. You take a couple more deep breaths to, you can sit or stand. We're going to just take a couple more breaths to just be in our body. Again, you can be standing or seated, your eyes closed. These practices are great for home care. You could do them on a daily basis. Quality of the stretches is way more important than the quantity. We've spent a lot of time opening these areas of restriction and tightness. Those areas of restriction become dehydrated when they're really tight. So it's really important that you drink extra water today, just to rehydrate that area. You continue to do a couple more deep breaths. And Dr. Wong can come back. Please let me know if you have any questions at all. You can reach me on the portal.
Thank you so much, Kari. That was great. It's brilliant, and drinking my water right now, hydrating.
Cheers.
Cheers, everyone. Got a little fresh water there. Yeah, I feel like I need to do this every day. You know, just I have some tight muscles in the hamstrings and probably QL lower back and traps here. You know, I think you know, a lot of times people have described how it's like one side, you know, more than the other is a little tighter. Thank you so much, Kari, for that. And you know, we definitely would love to have you back for more of myofascial release. I know a lot of people have had great, you know, benefit from even these sessions here. We can talk more about that. I think that Nancy had a couple of questions maybe, or she had one question. You might have answered that already. And then Babby had a question also. Thank you all for comments to Kari there. It's an amazing session here. Kari, could you comment on the, Babby had a question about with sciatica on the right side, that it comes with yoga and also with these exercises. Is that okay to feel that sensation when she's doing the stretching?
I was able to look at the question when we were doing the exercises, and I advised just to stay away from that pulling on the sciatic area, and I tried to give a different option.
Got it.
Just
Okay,
doing,
thank you.
like a hip flexion.
Okay.
But let me know if I need more.
Great. So a more gentle stretch for someone that has maybe have back pain from that.
Yes, less range of motion for the time being until that area can be healed.
And how I know this is probably hard to say, but how many minutes would you say is good to do myofascial release or these type of stretches per day, if you know, if someone's going to do it on a daily basis?
You know, it It goes back to, I think, the quality of it. If you really realistically can be present in your body for only 10 minutes, use
Mm-hmm.
that 10 minutes and do 2 stretches versus like 10. You know,
Yeah.
we always talk about reducing our stress. So if it's stressful to think of doing this a half hour a day for 5 days a week, then that's not the answer. But if you have more time, like say on the weekend, and you want to devote it to that, it would be a worthy cause.
You know what I've
But
noticed is we do have more time than we think, you know, especially when we get off the cell phone. You know, we get outside or we do
mhm.
stretches, and we probably have more time than we think. You know, even though it is time and it can be stressful, I think that's just a consideration. That's what I've found personally is you know, limiting the screen time actually creates a lot of time. So we can do that.
Yeah, I agree.
Yeah. Um, Mustafa asked, Amber felt a pull in the scapula when she raised her hand, like basically here, the back there. She, she asked, "Is that
So
normal?" To,
um, it just means that there's a restriction there, probably from her back or from her arm being extended.
mm-hmm.
So just spending some time in that area. Um,
And Kari did a Myofascial release session here on Zoom 2 weeks ago, and there was some. If you're on that, you can watch the replay of that too. I think you did some upper arm releases too on that one.
yes,
Helpful.
and the last one that I did, I mean, the last stretch of that session was a scapular release, so arm over arm, like giving ourselves a big hug.
Hmm.
So I think Amber
Mm-hmm.
would
Right.
feel some
Okay.
benefit in that.
Yeah.
Mm-hmm.
Great. Great. Thank you, everyone, for the comments. Thank you for attending. It's at 1 o'clock now, so we'll see you next week with Colleen, who I think is on the call. So, hey, Colleen, great to see you here. She's going to be talking next week about herbs for immune health, for stress, dosages. You know, how to best use herbs, and you know, how to approach herbs in general as a philosophy and as a way of life. I think too, which would be amazing. Thank you so much, Kari, and thanks for Jen for putting this all together as well. Thank you all for attending, and we'll see you here next week.